write a list. I have no problem. And we get to the end of the consultation. I'm like, right, let's check off your list. Have I answered all your questions? I think any open-minded doctor, nurse wouldn't mind that, because I think I would want someone to leave my room feeling as though they've been properly sorted out. I don't want them to leave and then 5 minutes later go, oh, I forgot this, or I forgot that, oh, and then they have to try and get another appointment, which we know is really tricky to get. So, but go with an open mind, because you might be pleasantly surprised.
This episode is supported by a proper local clinic just outside of Bishop Stortford. Most people don't wake up planning to see a chiropractor. It's the stiff neck that won't ease, the bad back that's killing your sleep, or that pain that suddenly makes work and family life harder. Takeley Chiropractic help people get out of pain and, even more importantly, stay out of pain. They don't rush you. They take time to understand you and make you feel better. They want to understand what you want to get back to doing, whether that's work, sport, or just spending time with your family. They're a local team, highly qualified, and recently they won an award for outstanding patient care. Have a look at takeleychiropractic.co.uk and see what they're all about. Welcome to the Bishop Stortford Community Podcast, the show where we shine a light on the incredible businesses, community leaders, and local legends shaping our town. I'm your host, James O'Donnell, and today we are joined by Gill. Gill, great to have you on the show.
Hello.
Hello. Gill, for those of us who don't know you yet, who are you and what do you do here in Bishop Stortford?
Well, I'm a Bishop Stortford local, so I live in St Michael's Mead, and I am a GP, and I do a lot of work around women's health and the menopause. And I run a local clinic that runs out of the Saba Health Clinic out towards Dunmore, and we run a women's health clinic. So yeah, that's me.
Why do you need a specific women's health clinic? Is that not something people can just go to the GP to sort out? I'm deliberately asking this.
No, please do.
As a flag.
Yeah.
To help the conversation.
Yeah. It's fine. I mean, the reality is, so the vast majority of the week, I'm an NHS GP, so you can come and see me at my NHS practice. The reality is, and I think anyone who works in the NHS, anyone who has to use the NHS will know, it is a pretty broken system right now. And it's very hard to get an appointment. And the whole system around women's health is disjointed. If you look at, say, erectile dysfunction, for every £100 spent on research, men will get £90 of that amount of money to look into erectile dysfunction, which only affects apparently 10% of men. If you look at that £100, women will get £10 of that, looking at women who have PMS and PMDD, which can affect up to 60% of women. Clinical trials, the blood pressure tablets you might take, they are all, up until only recently, they were all tested on men, not women. There's a huge amount of medical misogyny in the NHS, and women are the ones that are suffering. So we set up a private clinic. We only do it one morning a week, so it's not a huge amount of our time. But it's giving women that are struggling the opportunity to see someone in a more timely manner.
And there's also, this is something obviously I'm not experiencing firsthand, but from talking to women in my life, is that there seems to be a lot of hoops that women have to jump through to get to not necessarily diagnosis, but to proper help where people actually take them seriously. Is that your experience as well?
Oh, yeah. I mean, particularly around endometriosis, which is a pelvic condition, but sadly it's not just localized to the pelvis. I mean, it takes on average, I think, 8 years to get a diagnosis of endometriosis. I have women who I'm seeing who I will say, look, you've got endometriosis. I've done everything I can do in the community. You need to now see a surgeon. And they'll wait another 18 months, 2 years. A long wait for women. And it depends who you sit in front of. There's some superb people in the NHS. I'm an NHS GP the vast majority of the time, and I'm a huge women's advocate, and I do lots of lunch and learns. We do group menopause consultations in the evening. We do an advice and guidance for the PCN. We're such advocates, and you might find one of those advocates, but unfortunately not all people that you will sit in front of are advocates of women's health. And so sometimes you have to approach those meetings a bit more well-informed.
So what, by being well-informed, is there a certain type of question or way that you describe things that will help you move through a process more effectively?
Yeah, I mean, always be civil. So you walk in there with an open mind. I do have sometimes women come in who maybe don't know who I am, and they're ready for a fight because they've read the nice guidelines and they've read like lots of blogs, and there's lots of charities around, say, endometriosis, and they're like, right, I know I have to fight this because I have a right for this, and they're not wrong. But then they meet me and I'm like, of course, we'll do this. Yeah, of course, we'll do this. Yes, you need this. Yes, I think you've got this. So always go into it with an open mind because you might be pleasantly surprised. But then do all those things. So make sure you've read the nice guidelines on the condition that you want to talk about. Do read where the tertiary endometriosis centres are if that's relevant to you. Make sure you come with a list. I really don't mind a list because particularly I'm a woman in her 40s and I get halfway through sentences now and forget what I'm saying. So a lot of women will come in and just forget what they're saying. Write a list. I have no problem. And we get to the end of the consultation. I'm like, right, let's check off your list. Have I answered all your questions? I think any open-minded doctor, nurse wouldn't mind that, because I think I would want someone to leave my room feeling as though they've been properly sorted out. I don't want them to leave and then 5 minutes later go, oh, I forgot this, or I forgot that, and then they have to try and get another appointment, which we know is really tricky to get. So, but go with an open mind because you might be pleasantly surprised.
Okay. And open mind, list of symptoms. Is there anything else that people should be asking?
Well, I mean, it depends how far you go. When you're booking the appointment, book with the right person. So if you have a testicle problem, I'm the women's health GP. I'm probably not the best doctor to see. But if you've got a women's health problem, I'm probably the right one rather than, and I'm not, there's some very good male GPs who are very interested in women's health, but generally speaking, it would probably be more a female, but not, not always. But if you don't know who those GPs are, then ask your GP receptionist. They will know, right, this is the minor surgery doctor. This is the one that's really good with the elderly. This is the one that's really good with women's health. So even just get, and sometimes that means, I know, unfortunately, and I'm not proud of this, getting an appointment with me on the NHS is a long way. Women will say, I can get lots of appointments with the other doctors, but I can't get an appointment with you. But the reality is that if you can wait another few weeks, seeing me would probably be more productive for that particular condition. So you may have to appreciate, you might have to wait a bit longer to see the right GP.
Okay. Okay. And how does your clinic work then, the women's health clinic? What's the process there?
Yeah, so I mean, I would always say go and see your NHS GP first. Don't presume you're not going to be allowed HRT because you're too young, or they don't prescribe testosterone or what have you. So do try the NHS first. We all pay our taxes. There is some phenomenal people in the NHS. If you get the right one, you could have a brilliant experience. But if you have not had a good experience, maybe see a different GP. You might get a better experience. But if you're still kind of feel as though you're not getting where you need to be, then you can just book in with us online. You don't need a GP referral. Unfortunately, women's health and the menopause particularly is not covered by private health insurance. Again, we can talk about that as misogyny and stuff, but it is what it is. So unfortunately, you do have to pay for it, I'm afraid. Sometimes we see trickier patients where people have had really good support from the NHS, and maybe they're at the stage, particularly with menopause, maybe they need testosterone. No, the majority of GPs probably don't prescribe that. It is much more specialised. Some do, of course, and they may have to say, right, I'm going to refer you on to the menopause clinic at, say, Addenbrooke's, but there is a waiting time there, 6, 8 months, 9 months, and so people may choose, I'd rather do that quicker, and that they might come and see me. And then people with tricky health conditions, if you've got quite a complex history or you've been on HRT and it's not working, then it might be that you need just someone with a bit more experience or knowledge around it.
Okay. Okay. And with the clinic, it's one morning a week?
Yeah, so we don't do much. We're too
Okay.
busy in the NHS. But I think my husband would divorce me if I did any more work in the NHS. It's just one morning a week.
Okay.
Myself and Reem Al Sheikh, she's my partner in crime. She's fabulous. She loves Instagram. So if you follow her on Instagram, she's the one that does all the chit-chatting. She has like an amazing skill, which I don't have. So if you ever want educational stuff, she's brilliant. So Reem and I, we just do one morning a week in Bishop Stortford, and we do have a clinic in Cambridge and Ware as well. So we kind of move around.
Right. Okay. And is that, you say you're not going to do any more hours because there's only so much that we can all do.
Yeah.
But is that where it's at that you want it to be now, or is there things for the future that you're planning toward?
I don't know. I mean, it's been lovely actually, because I think when I was like 12 or something, I declared to my parents I was going to either be a hairdresser or a doctor. And so my career path was very much planned out, that these are the GCSEs I was going to do, these are the A levels I was going to do. And I got into uni, by the skin of my teeth. You got through uni, and then it was house officer at your registrar. My career path was very clear, and there's very little deviation. All the colleagues and great friends that I have who I work with, there's very little deviation. And then when we started this clinic, it was lovely because we joined the Rising Tide with Sinem. I think you've done a chat with her before. Fabulous woman. But it's a group of women that run businesses, and it was mind blowing, opening to work with such inspirational people that had such a different view on life, view on work. You know, it's like I was a kid again in a sweetie shop. I was like, wow, these women are just so different to me, and but in a lovely way. And so I've learned a lot from them. So I think going forward, the reality is what it is. I've got Stockholm syndrome with the NHS. I'm never going to leave it. I will keep on going to the bitter end, whenever that might be. But to be able to work with all these lovely women, a lot of them working in women's health and being women's advocates, I think that's something I'd really, as time allows, get more involved with, and actually building that community more. Because there's some cracking women in Bishop Stortford that just are fabulous.
Yeah, I'm scraping the surface at the moment through the podcast by interviewing them, but there are many more. I'm sure that we can be shining a light on. That's great. So if people are interested in getting in contact with you or booking in for a consult, where do they need to go online to make that happen?
Just our website. So it's just, you ask me now what my website's called. womenswellnessclinic.co.uk. So it's pretty easy to remember.
We will link up to that as well. So if anybody's listening, they can just go to the show notes and click through to that and look at your profile, see what you're all about, and reach out to have that conversation. Okay. That's been awesome, Jill. Thank you very much. Are you ready for some Stortford Spotlight questions now?
Yes, I am a Stortford local, so yes.
Fantastic. These are 3 super fast questions we ask every guest that come onto the Bishop Stortford Community Podcast.
I'm feeling quite pressured now. Okay, yep.
That's good. Okay. First question. If you could put one sentence on a billboard in Jackson Square, what would it say and who needs to hear it the most?
Bleeding through your clothes is not normal. Giving up your job because of menopause brain fog is not normal. Screaming at everyone is not normal. Go and see someone.
Powerful messaging in Jackson Square.
Yeah. We should talk more about women's health and things like that. It shouldn't be poo-pooed. And women, they very much, I've seen lots of people over the years I've been a doctor, and they'll tell me that they have to put a towel on their car because they bleed through when they're on their period. That's not normal, but women just put up with it because they've got other things to do rather than go and get help with that. And I think women need to give themselves the ability to put themselves first and go and get help, because if things like that are impacting your life, it's not normal, and there's lots of things that can be done.
How can we help women to ask that question?
I mean, I'm talking openly about women's health, and I say periods and vagina and vulva, and I use the correct anatomical terms. And I think just putting that on a public place that people hear, just giving women the confidence to be able to go and talk to someone about, actually, I'm having this situation and I don't think it's normal, and not putting up with it, and being the confident to have those conversations.
Yeah. So many people aren't confident about having those conversations. So normalizing and having safe spaces where they can come and talk to people.
Yeah.
So important. Thanks for highlighting.
Yeah.
That, Jill. Question 2. Where do you go in Stortford that you secretly hope never gets too popular?
Right, it's easy. So that is Albert's, the cafe next to Sainsbury's. It has the best breakfast in a 100-mile radius. The only downside is it's closed on Sundays, so I can't go there on Saturday and Sunday mornings. And they're doing a great job. Carry on. They've got my custom forever.
What's your go-to breakfast?
The full English, all bells and whistles. Yeah, none of this vegetarian malarkey, none of this half size, no, the full English.
Fantastic. That's a great shout out for Albert's. We had Richard Pink on the podcast earlier in the week, and he also shouted out to Albert's, which is great because they haven't had a shout out
in
100 episodes, and they've had 2 in a row.
Well, they haven't got a new chef because they've been fabulous for ages, so it's not new.
My only experience of Albert's at the moment is because I take the kids to the playground, and me and my mate get coffees from Albert's.
You should try their milkshakes.
Don't tell my son that. He'll be all over that.
They are.
I need a new mortgage if that happens. But we go to the playground, and this is the first time we went to Albert's. We went to the playground and we were taking the coffee, and we're like, this coffee's a bit good for
next to Sainsbury's.
For next to Sainsbury's, and for playground coffee where you're kind of running around and rest, all that kind of stuff. Yeah, we want to sit down and enjoy this.
Yeah. Well, now you know. Now you know.
That's a great shout out. Thanks ever so much for that, Jill. And last question. Who's doing something special in town that more people need to know about?
I would probably say actually the Bishop Stortford Swim Club. So I have two girls and they are little dolphins and they go there between the two of them most nights of the week. And I am always bowled over by the absolute dedication of the coaches. I mean, they must have a little tent and they live there because they're there in the morning, they're there after school, they go to all the swim galas. I don't even know if they have a personal life because they just seem to be there all the time. And they always say it takes a village to raise a child. Well, I think it takes a village to run a swim club. Well, not all the parents, but there's a huge amount of the parents that are volunteering to be the treasurer, to be the kit manager, to be by the side of the pool doing the timings. And it's just such an wonderful group of people and it's incredibly inclusive. You don't have to be a county swimmer or aspire to be a county swimmer. You probably do have to swim to join it, but apart from that, I've got a 12-year-old who's starting to, hormones, and sometimes she gets back from school and she's feeling a bit overwhelmed with life perhaps. She goes to the pool, she has some giggles with her mates, some jokes from Joe, the coach, an hour of swimming, she comes back a different kid. So I think they're really changing kids' lives and giving them just a different outlet from school, and what a fabulous kind of opportunity for our kids to have so locally. It's 2 minutes down the road. So yeah, cracking team.
Fantastic. It's a great shout out as well, Joe. We haven't had them on the podcast yet.
Oh, you should.
Should be coming on soon. That's the plan. But that's a great shout out, and what a fantastic testimonial for them. We'll tag them in this episode, so hopefully they get
a bit come along. If I could do it, they could do it.
Yeah, exactly. Well, you can go in there now and say how easy it is to jump on and have a little conversation. Yeah, that's the idea. Again, where's that best place for people to follow along online and see what you're up to?
So I probably the women's wellness doctors. So I'm not going to lie, I'm not the best on Instagram, but Reem this is like her second skill. She does lots of educational videos. There's an odd one and two for me, but not many. So if you want to learn more just generally about women's health and how you can advocate for yourself and what have you, it's got a wealth of educational information there.
Excellent. We will link to that so that anybody watching this can go along and follow along. Very interesting, very useful information that Reem shares on the social media there. That's great. Gill, that's a wrap. Thank you so much for joining us today on the Bishop Stortford Community Podcast.
Oh, thank you for having me.
Not a problem. If you've enjoyed this episode, the best way that you can support us, the show, is to hit follow, leave a quick review on YouTube, Apple or Spotify, and then share it on your socials, or maybe share it with someone in town who's not on social media, but you think might want to hear what Gill has been speaking about today. And if you've got a local legend, someone that's investing in the town, investing in the community to make it a little bit of a better place for us all to live, then drop their name in the comments as well, and we can invite them on the podcast and shine a light on the work that they're doing. Again, Gill, thank you so much for joining us today on the Bishop Stortford Community Podcast.